start the meeting.
All right, guys. Thanks. Afternoon, and hope everyone had a happy New Year. Thanks for taking time to hop on the call with us today for our weekly update call, our first one of 2021, which hopefully will be a little bit better year. As usual, we'll go ahead and start with data presentation. I see Jordan is on, so Jordan, if you want to go ahead and start with data review.
Sure. So I started sharing my screen with the updates for all of the counties. You can see that most of them remain in risk level E besides Wexford, which has moved down to level D. Kalkaska did move back up to risk level E, which is likely due to their increase in positivity rate from last week. The daily cases per million for the district continue to decrease, and the percent positivity just slightly increased by 0.5% this week, so holding steady around that 8.5–9%. We reported 306 new cases from Wednesday at 3:01 p.m. until yesterday at 3 p.m. There were 417 new cases over the past week, Tuesday to Monday, and the week before that there were 353 cases, so we did see an 18% increase in cases over the past week. Our total number of jurisdiction-wide cases as of yesterday was 9,618. Over that time period, cases were identified as coming from household exposure, care facility workers and residents, healthcare and first responders, as well as other essential workers, those who were in attendance of social gatherings, including some Christmas gatherings and religious services, recent travel, pre-surgical testing, community contacts, and other worksite exposures. Cases by county as of yesterday are Crawford with 459, Kalkaska 473, Lake 288, Manistee 594, Mason 937, Mecosta 1,620, and Ferris State is reporting 532 cases as of January 4th, Misaki 475, Newaygo 2,217, Oceana 1,580, and Wexford 975. In the past week, there were 9 deaths reported and 865 people recovered. Yesterday, there were 9 positive inpatient cases at Munson Health Cadillac, 6 at Munson Grayling, 2 at Munson Manistee, 6 at Spectrum Health Big Rapids, 7 at Spectrum Health Gerber Memorial, and 5 at Spectrum Health Ludington.
Okay, thank you, Jordan. Any questions for Jordan on any of the data? All right. Well, then the other big thing that we do continue to work on is our vaccination progress throughout all 10 of our counties. We have been having meetings with both our Munson healthcare systems and Spectrum healthcare systems to, try to assure that we are working together and collaborating together. I know Brett leads our planning for conducting vaccination clinics. And so, Brett, I don't know if you want to share a little bit about what we've discussed and kind of what our plan is moving forward with clinics.
Yeah, I guess first, we're starting to see larger amounts of vaccine coming in. So last couple of weeks, it's been 1,000 each. And I believe this order, we're going to have 3,000. And I believe we might be even getting more than that the following week. So our intent as an agency is that whatever that amount is that we are able to receive from the state, our plan is to use all of that vaccine within that 7 days. And we actually have a benchmark. The state has required health departments to distribute 90% of their vaccine shipment within 7 days. and that's our goal. Our intent is to do 100% of it. So what that means is that as these vaccine allotments, weekly shipments increase over the weeks to come, we are going to schedule as many clinics as necessary to be able to provide that vaccine. So that's what our internal group is working on in terms of based on our understanding of what we're going to be getting in the weeks to come. We're staffing clinics, scheduling clinics, and then we'll be reaching out to our partners to kind of fill gaps with staffing to assist us. So that's primarily the main thing that we're focusing on at this point.
Okay, thanks, Brett. So this week, what we're looking at is we do have clinics scheduled this Friday. We have a clinic scheduled in all 10 of our counties this Friday. And then beginning next week, we will be looking at doing multiple clinic days in each of our counties in the health jurisdiction. So I don't know, Sarah, are you on our update call?
I am.
Do you want to talk a little bit about the reach out process?
Sure. We have been sending, we have a email template that we're sending out to all the healthcare workers. In that template includes an electronic link to the interest survey for the facility. We're trying to make sure we're tracking everyone that we've reached out to, and it allows us to see how many employees are looking at getting vaccinated for planning purposes. And then there's also an employee pre-registration link that the organization can share with all their staff that meet criteria for healthcare worker. And so those have been going out probably since late last week. We are hitting up physician offices, surgeons, optometrists, anything related to the eye. Dentists have been on the list, our funeral home directors. Let's see, today a lot of our home care agencies are going out. This afternoon, there will be a notification going to the ISPs to address their speech therapists and physical therapists and occupational health. Kevin, who else am I missing?
The AFC homes. We
Most
do have
of
our
done by the state, but we have a list of about 40 that District 10 will be responsible for, and our local public health nurses are reaching out directly to the AFC homes, assisted living and homes for the aged. So those will be scheduled basically by our public health nurse. Try and make that work as efficiently and as fast as possible.
Hey, Sarah, we've got a question that says, when do you plan to start the sheriff department vaccinations, as I have to give some advance notice in Crawford County?
So, we think that probably we'll have a firm plan next week on moving into how we will be moving into some of the critical infrastructure staff. So if you give us till next Tuesday's call, I'll have a much clearer answer to that. But I do think that that's coming relatively soon. We just have to get our healthcare workers in.
It never fails. And the air gets to it.
Somebody's not on mute. If you could mute your phone, please.
One of the questions that we've had a lot of requests kind of center around those people who are doing home care in maybe a non-traditional sense. They might not be working for an agency, but they're doing home care services, whether that's for a family member. And we are considering them part of the healthcare provider group. And so we're encouraging those people to reach out and get our link to register. I think that's probably it for right now. Unless there's questions.
Yep, another one related to that is, would that list include public educators?
Our school personnel are not in phase A1 or 1A, sorry. So those would be coming in the infrastructure. So we'll know more information next week on how that's going to look. The ISDs are a little bit different in that they have a lot of staff who are going into the home and doing services for the medically fragile population. And it's considered healthcare providers. So if you're talking teachers, we're not quite there yet.
Okay, other questions?
Hey, Kevin, just a note that if the question in regards to the sheriff's department had anything to do with EMS, we did EMS medical first responders last week. However, there's a lot of people who are on vacation or not able to come in. They can still register. I believe Karen is sending out that link again with our our facility interest form, and that's going out to all the fire departments and EMS and medical first responder group to get them to go ahead and complete the link and to share the pre-registration tool with any of the staff who had not yet been vaccinated. So that will be an ongoing, they can do that whenever. So if people are still on vacation this week and they get back next week, that link will be open and they can, staff can go in and pre-register at any point and they will get a call back. Our goal by the end of the week is to hopefully, cross my fingers, that we will have a mass clinic scheduling system in place where it will not take District 10 calling people back to schedule their appointment. When you go to that link, you will be able to go in and pick your own appointment. So that is coming and that will speed up our process significantly. But we are only scheduling via the electronic form. So if someone doesn't have access to the internet, they can, hopefully we will soon have a method. Well, we do have our hotline number they can call and we'll help get them registered over the phone.
Sarah, question is, if an agency hasn't received an email or link, how should they reach out? Local office, specific email, or person?
If it's a healthcare provider organization, Liz, you can either email me directly or you can email covid@dht10.org and I'll put that link in there and we can send them the information.
All right, we might as well do the next question. It says Oceana County law enforcement agencies were notified by MHP of available vaccination scheduling starting as early as today, if this is helpful to anyone.
Okay, other questions that people have?
Kevin, this is Bob Sobey. If I could ask maybe a follow-up regarding critical infrastructure workers. It sounds like that broad category or grouping does include some non-law enforcement. Is that correct?
It will, yes.
Okay. Okay, thank you.
Yep. And I know there was a question also related to vaccination on our last week call, and it had to do with if once someone has completed their vaccination, if they are exposed to a positive person, would that individual still have to quarantine? I did check on that. I thought I knew the answer, and I was correct. The answer and the guidance right now is that yes, even if you have completed your vaccination, that individual still would need to quarantine if they are exposed to another positive person at this time. We're still waiting on the data in terms of the immunity and how long that immunity may be there for. But as of right now, the guidance is that the person would still need to quarantine once they've completed their vaccination series. And again, for Pfizer, that's 21 days, and Moderna is 28 days. It's between shots.
Got another chat question. Knowing you want to hit 100% of your vaccinations allotted, what happens to the doses when people decide to not receive the vaccination?
I just kind of answered that in there because I saw it. Sorry, Brett. But basically, our goal is to be scheduling out enough weeks in advance that we can call people who may have a scheduled appointment next week to get them in this week. And so we'll have that rotating schedule to pull from. But our goal is to schedule around the number of doses in a vial. So there's 10 doses in a vial. So we'll always be scheduling around those 10. And if we don't get enough for a 10, they will just get moved to the next clinic.
And we've had to do that even now, working with the healthcare and the EMS folks that we've done. I know I've gotten some calls from individuals wanting to know why certain entities were able to be vaccinated, and it really came down to who we were able to find that was, if we had 4 or 5 doses of vaccine left versus allowing, having to pitch that away. We did reach out to individuals, and who was ever able to get there the quickest. Those were the individuals that we did vaccinate. So again, we did not have to waste that vaccine.
Next question. Are you saying if you had both doses, you would still need to quarantine if exposed to a positive case?
At this time, yes, that is the guidance.
And per Deborah's question, if so, how long?
It would be the normal quarantine time frame still.
That was the last question I see in the chat box. Any other questions from the phone?
Yeah, I've got a follow-up to that, Kevin. This is Jeff with Manistee County, and what's this? If we are vaccinating, I certainly would think the intent would be that that person, are they carriers if they're exposed? Are they not carriers? One would assume the intent of a vaccination is that you are not a carrier and you're not able to get sick. So I guess I'm at a loss as to why, if someone was exposed, they would have to be under quarantine. That's one question. I have another one after that.
Okay. Well, the vaccination, Jeff, is going to be very similar to the flu vaccination. Once someone is vaccinated against the flu, you still can contract the flu. Generally, though, it is not as severe and symptoms are not as great. It's not 100% absolute guarantee that you're not going to, that you won't become infected with it.
So it's similar to the flu vaccine, unlike other vaccines that we have, and as we have been exposed to from our childhood days on, to where, whether it be the mumps or what have you, there's a difference, is what you're telling me.
There is a little bit of, yes, there is a little bit of a difference. And even some of those vaccines, we still have seen individuals becoming infected with those diseases.
Okay, then the follow-up, are in District 10, as far as the vaccines we are getting, are all of them being utilized, or has any of them been not been able to been administered in a timely manner and lost?
To the best of my knowledge, we have not had to waste any vaccine at this point. Like I said, we have been able to, in the clinics that we have run, when we've found that we have extra doses, we have been able to find individuals that we can put that vaccine in their arms.
Okay, another question in regard to this, and that is, have we been having, I see some numbers on different media, different parts of the country, Some of the medical professionals have not been taking that. We've had any of those issues here in our region to where certain percentage are refusing to take those vaccinations yet?
I mean, I know in some of the EMS groups we've had initially, and again, this may be partly because it was before the holidays and people were concerned of maybe being sick or having any side effects over the holidays. Uptick among the EMS folks was not as high, I think, as maybe what was expected, but that was not unique to our jurisdiction. That was actually something that was seen statewide. So, now that the holidays are over, it'll be interested to see how many of those folks who maybe didn't take advantage of it the first time may want to come back in and take advantage now. We also know that we've had some individuals who have told us, they're not going to be the first in line to get this vaccine. They're going to want to wait a couple months to see how it goes, and then they plan on getting vaccinated.
Okay, not to monopolize, but one more as a question I was asked, and that is the seniors out in rural areas that do not have access to the internet or the knowledge, if they even do have access, to get the vaccinations, how far off into the future, what's going to be the process to try to get that communication out to those?
And that is some of the conversation and discussion that we're having right now as a follow-up to, okay, so this is this group that has that internet capability, and now for the rest of that population that doesn't, how are we going to get that information out to them? If that's through the Council on Aging's, the senior centers, what are, any and all avenues I imagine we will explore utilizing to get to that population. And I don't know if Sarah has anything else she wants to put in on that or contribute to that.
I do know that we've had conversations, for example, with Munson, that when it gets to the older population, which is getting a lot closer to my age, but that we would be using our physician partners to do notifications, even if they don't have vaccine themselves to give, that they would be sending out notices or calls or emails or whatever to their population, letting them know to get with us. Now, I'm pretty certain the hospital is going to partner with their staff that do a lot of healthcare insurance application assistance, that will be partnering with them to help get those people who may not have internet access registered.
And that's probably another good point to bring up, Sarah, about the primary care providers, because we do know that a number of them within our jurisdiction have registered to be a provider for this vaccine. So we know they are in the queue to get approved to be a provider for it. And once that is finalized, which we're hoping by the end of this month to see some movement on that they will be able to order vaccine and begin to vaccinate their patients that come in and see them. So, I mean, that is another piece of the whole vaccination picture that, that we're, looking to utilize to try to get as many people as possible vaccinated.
Okay, we got a couple more chat box questions. So the first one is, according to the Michigan.gov vaccine dashboard, Masaki has had 65 doses administered. If I recall correctly, the initial allotment was 100 doses. What happens to the remaining doses that were not administered? Were they reallocated somewhere else, or am I misunderstanding?
Those doses may have been reallocated to another location, or those doses will be used in this coming Friday's clinic or subsequent clinics.
So just a note on that. When the state did their allocation, they gave us 1,000 doses, and they gave quote unquote, every county 100 doses with no recognition of population. So of course we're vaccinating based on the number of provider calls that we have, the number of providers, healthcare workers in our communities. Same with EMS. So we're kind of not, we we obviously wouldn't stick to 100 in Wexford County or Mecosta County where our population's much higher. So we're adjusting based on the priority groups and vaccination request responses. But once those numbers pick up across all of our counties, I'm not thinking we're not vaccinating population-wise, because we will be. But those doses don't like disappear. They sit in the freezer until the next clinic and they get pulled out. I hope that made sense.
Okay, how do you determine what group is next up for extra doses?
Well, if you slip me a $10 bill, I'm kidding. I'm kidding. That was a joke. You should all be laughing. Our goal is that we will have weeks of schedules of people in those schedules. And if by chance we get people who cancel, we would be grabbing those people from the future schedules and pulling them into that day. Again, we're trying to schedule on that vial dose of 10 so that we don't schedule an extra 2 people. But that's kind of how we're going. Also, if we know that there's a physician's office close by, or if the sheriff's department's right down the road and we can get them in fast, our goal is to not waste any vaccine. So we may step outside of the priority group schedule in order to not waste vaccine, but we will target people who are in the next group level. Does that make sense, Brett?
Yep. Okay, are we able to adopt the new quarantine guidelines for employees that was previously halted due to PA 238, but has now been addressed with SB 1258? Do we defer employees to follow the healthcare provider recommendations on timeline or DHD 10?
The new guidelines that are included in that bill that I believe has since been signed are the quarantine guidelines that are in place. And I believe that would include the 10-day quarantine period, provided there have been no symptoms, and continuing to monitor symptoms for another 4 days for that total of 14 days.
Okay, next question. We have over 220 people currently on Meals on Wheels in Newaygo County. Is there some type of flyer that can be provided to these people that will instruct them what and when and where to get vaccine? Most of them do not have internet access.
I could take that one. That would be a yes. We can easily do that. Once we're moving into that age population, we will be working very closely with our senior centers, area on aging, and other human service groups to help make that go faster and to help get people enrolled who might not have internet access. There will be other options, including the phone.
All right. Should municipal governments be forwarding lists of employees, police, public works, admin, who have indicated they want the shot, so that they can either be called as a group or as fill-ins for available slots that may come up?
Kevin, you want me to take that one?
Yeah, I mean, I know we've gotten some of those lists have come in, but Sarah, I know, we've kind of tweaked that process a little bit, so I'll let you.
Our process is much faster if we have an electronic pre-registration form done. So again, if we can wait till like next Tuesday's meeting, by then I think we will actually have a link for Phase B organizations to at least complete the interest survey. And then we will obviously kind of triage that list to prioritize those groups that we would put in a call to get people into fill-in clinics. So if by next week we'll have a system in place, but it will require the individuals to, we don't want your list, because if you do the electronic form, it gathers everything for our EMR and it speeds up the process. So that's kind of the direction we're going, and we should have those bumps worked out, or at least the process started by next Tuesday's meeting.
And then Sarah, can you see the chat box where Joseph says he'd like the response emailed?
Sure, I can do that.
I think that's the last chat box question, Kevin.
Okay. Any other questions? I don't know if anybody's on the phone or anything. Okay. If not, then that's what we have to share today. Again, each week we'll have a little bit more to share regarding vaccination. I would imagine next week, Tuesday, we'll have more information to share, as well as some additional vaccination numbers from our Friday clinics that we can share with you. Again, you know, if at any time anyone has any questions, don't hesitate to reach out to us. We'll get you an answer or find an answer to you. And other than that, thanks for taking time to hop on the call with us today, guys, and we will talk with you again next week, Tuesday. Thank you. Hey, Brett, can you and Sarah stay on?